And welcome back. When the only hospital over in Aransas County shut down due to damage from Hurricane Harvey, standalone emergency rooms became essential for providing care to folks in that area.
But it is against federal law for those clinics to accept Medicaid or Medicare. KRIS 6 News reporter Jane Caffrey joins us live in the studio. Jane, we can't imagine this being good for patients.
Well, Stephanie, it leaves them very few options. Patients need to decide whether to drive miles to a facility affiliated with a hospital or pay out of pocket.
Physicians at the Code 3 emergency room in Rockport didn't expect to be flooded with patients after Hurricane Harvey hit, but that's what happened when the storm damaged and shut down the county's only hospital.
We've now taken on an entire area of the coast of Texas here that doesn't have access to an emergency room other than us.
And many patients are on Medicaid or Medicare, but under current federal law, that insurance can't be used at standalone emergency rooms like Code 3. And since the clinic cannot get reimbursed, they give those patients two options: pay out of pocket or go to another facility. But if a patient's life is at risk, Code 3 physicians are required by Texas law to provide care. And they do, they just don't get paid for it.
So we take care of them, we stabilize them, we call a helicopter. They get paid for it, but we don't for doing all the care up to and including calling the helicopter.
And the lack of coverage can also create life-threatening situations. If a Medicaid or Medicaid patient calls 911, the ambulance will not bring them to a standalone ER because that trip wouldn't be covered. Instead, they go to Portland or Corpus Christi.
The time delay for evaluation by a physician can be the difference between life and death.
Now the physicians are working with members of Congress trying to get disaster funds to treat Medicaid and Medicare patients. Whether they're covered or not, the clinic is treating those patients in emergencies. And since Harvey, they have provided $1.3 million worth of health care without reimbursement.
No business can survive if you're not getting compensated for 70% of your business. We need that assistance to make sure that people in this county still have access to care that they deserve.
The physicians at Code 3 Emergency are also working with members of Congress to try to permanently change this policy. They say the best way to get the federal law changed is for patients and others to write to their congressmen and senators. Lee.